Okay, I'm going to be mixing insulin and administering it. First, I'm going to verify my orders and be sure that I have the correct order and the correct patient, along with the correct medications. I'm going to check the expiration date on the vial. Okay, I have the NPH cloudy. And I also have my regular insulin. I have gathered my supplies. My next step is to perform hand hygiene and apply my gloves. And we have our insulin syringe, alcohol prep. Okay, so we want to be sure and roll our insulin. With the different wipe, we're going to clean the top of the bottle. Okay, so we're first going to pull back 40 units of air into our syringe. And inject this into the cloudy insulin first. You only want to inject the air without touching the insulin. And withdraw the syringe. And then draw back. We're going to give 8 units. And this time you're going to go ahead and let those 8 units come back in. And be sure you don't have any air bubbles. Okay. We're going clear to cloudy. And here we have our 40 units of air already. We're going to be back to be very careful. 8. And on this particular syringe, you don't have the hub to pull back, so this is the only time that we may recap the syringe. And since we're drawing this medication up outside the patient's room, you want to be sure and label the syringe with the patient's information. And we're just going to use this piece of tape. And what's in the syringe actually is most importantly. And when we get to the bedside, we're going to, of course, verify that we have the correct patient, the correct dose, the correct medication, and you're going to assess the skin and be sure there's no skin irritation. I would actually have put on new gloves at this point to perform hand hygiene. So once again, we're going to take our alcohol wipe, and you can apply, you can administer insulin on the backs of the arms and the subcutaneous area, 1 inch around the umbilicus, and you want to be sure to rotate sites. So we're going to pretend that this is our skin, this is our umbilicus, so we're going to come out here and cleanse the site really well. Explain the procedure to your patient. And you're going to pinch about 1 inch of earth skin and come at a 45-degree angle. And I'm not going to push, but you're going to push the medication slowly. And then you're going, some syringes you could pull up and lock the syringe, the needle. But in this case, we are going to dispose of this in the sharps container. You can apply, come back over the site with the alcohol wipe. Make sure there's no bleeding. Make sure your patient is good. Remove your gloves. You want to perform hand hygiene again, and you want to document what medication you gave, where you gave it. You also are going to want to document their blood glucose level. Sometimes they're receiving the insulin on sliding scale, not necessarily routine scheduled insulin. Thank you.